Hello everyone, it's me Dr. Ayaz Ahmed, working as an aesthetic dermatologist. So today I will discuss another important topic of dermatology. The name of topic is management of atopic dermatitis. So I think before I proceed to management, I would like to tell you that here in this case of atopic dermatitis, the constant advice and cooperation between healthcare provider and patient is required because the most of the patient of the atopic dermatitis they do have complaint of itching and dryness which usually remain in whole of their life. So before I proceed to management, it is very much important to give advice and remain in good cooperation with patient. Assess family history and triggering factor and home environment first. Examine whole skin to assess severity and complication and comorbidity. So first line treatment or number first, give them advice and educate to reduce triggering factors. Bathing and showering with emollient. These are used in all cases as a maintenance therapy. Topical corticosteroids are used in a severe cases. These are used as a maintenance of anti-inflammatory therapy. Use of antibiotics, antihistamine, and sedating agents are also advised whenever the secondary bacterial infections are suspected. General advice and education. Our aim is to reduce complaint of severe itching, improve sleep pattern, reduce absenteeism from school or work area, and improve cooperation among the family members and reduce triggering factors. So there are lots of factors which are involved in atopic eczema. They are not only involved but they are provoking the situation. These are number first irritant. Irritant may be soap or detergent which we usually use in our daily life. Another important factor is the wool clothing or wool clothing containing wool. Third is the winter chapping. Fourth is the excessive heating. For example, in winter season, we usually use heater to heat our room. So excessive heating here is concerned with atopic eczema. Sweating, airborne allergen. There are lots of airborne allergen which usually provoke atopic eczema. For example, in air we usually it usually contain dust and some pollen grain from different plants. Food allergen, skin infection, stress, habitual scratching. These are all the triggering factors which are involved in the uh, provoking of atopic eczema. So these are the age category. For example, 0 to 2 year, 2 to 12 year, and 12 year, and then towards adult. So these are the age category which usually describe irritant. So 0 to 2 year, the most common irritants which are usually which are here kept at top are irritant. Number one, saliva, soap, detergent, food, and clothing. These are the irritant category most common in the year from 0 to 2 year of the age. Then sweating, drying or central heating of a room, scratching, then food, for example, eggs, cow's milk, wheat, house dust, mites, pets, and family dynamics are here important aggravating factors. In age category from 12 year onward towards adult, these are the most common are sweating, drying, for example, central heating, scratching, irritant, which includes saliva, soap, detergent, and clothing, which I have mentioned earlier. These are the same. Infection, airborne allergen, for example, grouse, tree pollen, HDM, animal dander, and contact allergies, including topical creams, stress, occupation, and foods. These are common allergen or common aggravating factors which are usually present from 12 year onward. Moreover, both these factors are usually common from 2 to 12 years of age, as seen by this arrow in the middle. This is a child having atopic eczema. You can see this angular cheilitis present here. It is due to aero allergen. In next picture you can see this is a similar child, but you can see the facial dermatitis secondary to aero allergen along with lip cheilitis. Here important point is that the aero allergen usually cause facial atopic dermatitis. So this is a picture of another child. You can see periorbital dermatitis or periorbital atopic eczema. This is a European child and this is Asian child. You can also see similar changes in this child as well. So these are all due to aero allergen, which are usually involved in causing atopic eczema in the region of face. Topical therapy. Topical therapy include bathing with emollient, which is very soothing and reduce quantity of corticosteroid requirements in skin. Emollient dose is usually 150 to 250 gram per week in a child and 500 gram in an adult. Topical suppression of inflammation is done by daily evening application of steroid with emollient in morning. In corticosteroid resistance or infected case, use antibiotic or combination of antiseptic and steroid are used. Maintenance therapy for steroid. Here remember that do not go aggressively with steroid. One fingertip unit is enough to cover 2 palm area. 10 gram per week in a child is not excessive quantity. Side effects are stria formation and telangiectasis. Use topical calcineurin inhibitor in eye to avoid glaucoma. Here important thing is that a person who is using steroid in a region of eye may develop glaucoma. So in order to avoid this catastrophic side effect, use calcineurin inhibitor. Oral therapy. For oral therapy, use prednisolone 0.5 mg per kg. It has a limited but definite role in controlling the atopic eczema. Second option is the anti-inflammatory agent and emollient. Third is the H1 receptor are used. For example, hydroxine, promethazine, trimiprazine. Give 1 hour before bedtime. For Staphylococcus aureus infection, use erythromycin and flucloxacillin antibiotics. For viral infection, use oral herpetic medication. For toxic patient having fever, go for IV therapy. Dilute bleach bath and potassium permanganate soaks are also used. Thank you very much. Stay connected and subscribe my YouTube channel.